OB-GYNs are at the forefront of providing excellent care to women of all ages, but sometimes complex gynecologic conditions require advanced surgical care. And today, Dr. Rohan Hattiangadi from EvergreenHealth Women's Specialty Care and Gynecology is here with insight and advice. I'm glad you're here talking about this.
Thank you so much for having me.
It's key and important, and I think you said when you were on here before you had a lot of women calling saying, yes, I need to see someone, and thank you for talking about this. So it's real important. Right. Tell me first, what services does your clinic, the Evergreen Women's Specialty Care, provide to women?
So the EvergreenHealth Women's Specialty Care Gynecology Clinic is a subspecialty clinic of gynecology. So it falls under the division of OB-GYN, but I don't practice obstetrics and I don't do routine gynecologic care. I really focus on these specialty conditions that are quite complex and often require surgical intervention. So things like endometriosis, adenomyosis, which can cause pain with periods, pain with a lot of daily activity, fibroids, which can cause very heavy bleeding, and uterine prolapse.
So that's what you said. So the difference is the normal care that you'd think of, checkups, pregnancy, that kind of thing. You're not seeing that. You're seeing the
Correct.
special conditions.
Correct.
And what are some of the common complaints that women bring to you?
A lot of times patients will see me for heavy periods or irregular periods, painful periods. They can see me for fibroids or masses that can cause pain or irregularities in their cycle. And oftentimes, by the time they've been referred to me, they've seen a primary care doctor or a gynecologist or a general OB-GYN in the community who's done ultrasounds and found these problems that require surgical management. And then I go ahead and do a minimally invasive surgery to try to improve their quality of life by taking care of the problem that's there.
And what sometimes would that involve, the minimally invasive surgery?
So minimally invasive surgery is not just a single procedure. It's really a philosophy about how to take care of women in a way that you minimize the impact of the surgery to them in terms of how long they're in the hospital, how long they're taking pain medications, their bleeding risk, how quickly we can get them back to their normal life. And so by employing these philosophies in the way that we do surgery, we can do surgery through laparoscopy, vaginal surgery, robotic surgery, hysteroscopy, so that there are small incisions, less pain, right, less bleeding, faster recovery.
Right. Downtime is...
Exactly.
You've cut that down.
Exactly, because my goal is to find the problem that is impacting your quality of life and improve it such that we can get you back to your normal day-to-day function.
So often these things are not talked about, the problems, and I know that I had an ablation about 16 years ago, and I went to because of heavy bleeding that I never really talked about, and it took me so long to go to a doctor about. But then I went to my girlfriends and I said, I'm having this ablation, and they're like, oh yeah, we had that. It's changed my life. And this did change my life, but I think, how do we normalize talking about it and maybe even getting to a doctor sooner?
Yeah, well, first of all, I'm really glad that you did the ablation, you listened to your girlfriends, and that your quality of life is better. I just don't think we talk about it enough, and nowadays we're very fortunate because we have the internet, we have forums and communities and social media where we have a lot of people sharing their stories, and so it gets the word out there. But I think once we hear about these things, then it's really up to us to go to the doctor and seek out this care. And when you're experiencing heavy bleeding or pain or fibroids or need these type of surgeries, seek out a minimally invasive gynecologic surgeon such as myself, and we'll talk about what seems to be the problem and how we can address it and the variety of different minimally invasive options that are out there. And I think we just need to lift the fear about talking about these things in public and really make it more normal. And I think we'll be able to really address it.
I appreciate that. Just talking about it more and being more open. And I know my daughter has endometriosis, and they don't have a problem talking about it at all. And so I'm taking a page out of her book from an older woman, right? Yeah. How can someone schedule an appointment with you?
Yeah, so it's actually pretty easy. So I am at the EvergreenHealth facility in Kirkland, and the primary ways that patients can come see me are either through a referral through their primary care provider or their OB-GYN, or they can call in and self-refer. It's helpful when we get referrals from an OB-GYN or a PCP, because then we can make sure that the appropriate labs and imaging studies and everything is done before I see you, so we can get you to the operating room quickly if we need to and try to address your concerns as soon as possible.
Thank you. I appreciate that passion in your voice. I can hear it. Appreciate that for women. Thank you so much. And to learn more about EvergreenHealth Women's Specialty Care and Gynecology, please visit that website you see on your screen.
This portion of New Day Northwest is sponsored by EvergreenHealth.